Hey everybody, welcome back. It is another video in our Caring For and From the Heart series in February 2024. If you have missed any of our other presentations, click the link in the show notes below and you can be taken to all of our other replays. So this week we have an amazing presentation from our dear friend Mary Coughlin. She is going to talk to you about the courage to give compassionate care. In this presentation, Mary is going to share strategies and a rationale for cultivating our own compassion of ourselves so that we can then provide better care for families, for babies, and for our coworkers in the NICU. This presentation is filled with science and soul. We know those are the hallmarks of Mary Coughlin, and I know in this presentation you are going to learn so much. She really walks you through the science from the beginning of compassion and where it comes from, how we can operationalize that. She says it's kindness. We can demonstrate kindness to others, and that is the first step towards offering compassion. But she really emphasizes how we need to also be compassionate to ourselves. Mary teaches us a lot about trauma-informed care, and we all need to recognize that even though we are a witness to the suffering of others, that we can lend a hand. We can offer kindness and show compassion, which is the center of caring. And it is that thing that, especially as nurses, we do, but everyone who comes in contact with babies and families in the NICU, we all need to learn how to offer compassionate care. It really makes a difference, not only in the short term, but the long term. So if you would like to get the slides to follow along with this presentation, either scan the QR code here on the screen or click the link in the show notes below. You'll be taken to a page where you enter your email address and you can download the slides right away. Also on that page, we'll get access to all the other videos from February series on caring for and from the heart. And as a reminder, if you haven't already, go ahead and head over to our YouTube channel, hit that like and subscribe button. It really helps us out a lot. And don't forget to hit the notification bell so that you know when we bring you new content. This presentation was done at our 2021 conference in Orlando right before the pandemic. And in this presentation, Mary does ask you to stop and to reflect and to take a moment to really think about some of the things that she's teaching, not just filling your head with knowledge about compassion, but really helping you to operationalize that into your daily practice. So I would encourage you to be ready with a pen and paper, or at least the notes app in your phone, so that you can write down some of your takeaways and really begin to put this into practice. So without further ado, I hope you enjoy this presentation from Mary Coughlin.
Again, I'm wicked honored and privileged to be able to present this topic to you. I feel very strongly that the idea of courage and compassion really underpin our individual capacities to really provide trauma-informed care to the patients and the families we serve, but also to each other, right? In bearing witness to the most tragic things that can befall a family, we need to stop fooling ourselves and thinking that it's not affecting us. There's this really cool quote from one of the Chicken Soup books that talks about, I'm going to paraphrase it, hopefully I don't trash it, but it says something to the effect that bearing witness to tragedy day after day and thinking that it's not affecting you is like walking through water and thinking you're not going to get wet, right? It just doesn't happen. We just generally don't pay attention to that, right? We shove it down, or we push it past, or we pull up our, big girl pants. We do all these crazy things to try and pretend that it's not really affecting us. And so over this next hour, I'm hoping that you'll be able to find the courage to really care for yourself, because if you can't really care for yourself, you really can't bring your A game to your patients and families. And as I say that, I'm reminding myself that I wanted to say what I'm about to say to you guys. Generally, the folks that come to these conferences are the people that are the champions and the cheerleaders, right? They're all part of the choir. When we come here, we get excited and feel like you're a soothing balm on our souls, like reconnecting with other like-minded, passionate people. And so I'm hoping also at the end of this talk that in addition to cultivating courage within yourselves, to really empathize and be compassionate, that will also help our colleagues, our Barbaras, to find the courage to uncover the light that lies within them as well. Because I really have come to the place in my head and my heart that Barbara doesn't even know she's Barbara, right? She needs a big hug. She needs a lot of love. She's really got tons of armor on her that she doesn't want to shed, because then she feels like we'll see her soft, gooey center and we won't like it. But we love soft, gooey centers, right? And that's why we're all here and why we're doing this work. So the courage to care, finding compassion in the chaos. I don't believe I have anything to disclose. Y'all know who I am. Just coming out of the gate, what I'd like you to do is take out your pen and a paper and just jot down somewhere on the notes or whatever, the slides, what your answer is to this question. What are your challenges to compassion and caring in the NICU? Do you have any? I want you to think hard, because you do. Just jot them down. Go ahead, I'm watching you. Write it down. Or pretend that you're writing, all right? Just follow instructions, please. Because at the end of the talk, I'm going to ask you if anything that you've learned or picked up as I've been talking, is it helpful for you to overcome some of those barriers and challenges? Okay? All right, so my goal is that you'll be able to define compassion and list 3 benefits to self and other when operationalizing compassion, list 3 barriers to practicing compassion for self and others, and identify 1 strategy that you can adopt consistently to cultivate compassion for yourself and for others.
Sometimes it's easy to feel like the world's getting harder. But if we look closer, on the news, on the web, on the street, we're anything but unkind. Every day, we hear new stories of people trying to make the world a better place. And together, we can make the world that little bit kinder for all of us. It all starts with just one person, you. The thing about kindness is that it's just about the only thing in the world that doubles when you share it. And it's a fact, backed by science. Studies have shown that if you perform just one random act of kindness a day, you'll not only reduce your stress, anxiety, and depression, but your body is flooded with the same hormones that make you and the person you've helped calmer, healthier, and happier. Serotonin, which heals your wounds, helps you relax and makes you feel good. Endorphins, which reduce pain, and oxytocin, which reduces blood pressure and makes you feel more loving and loved. You'll both be more energized, feel less aches and pains, more confident, and could even live longer. And if other people see you helping someone else, they'll be filled with those same feel-good hormones, meaning they're significantly more likely to pay it forward. Like taking that extra moment to hold the elevator for someone, spotting a coffee for a stranger who's just a few cents short, giving your neighbor a hand with their groceries, even just smiling and meaning it. It doesn't take much, but it can make a huge difference for everyone. Those people you've helped will help other people, and those other people will help even more people. And those random acts of kindness can start a chain reaction that can spread across an entire community, a city, a country, and with enough of us, the world. Now, isn't that the world we all want? And it all starts with one.
Now, we all know this, right? Y'all know if you're kind to other people, it feels good to you, feels good to other. Then my question then is, why do we struggle with this? And why do we struggle with this on duty when we're in the unit? Now, I don't know about you guys. Actually, I do. I know a little bit about you guys. If you work in the NICU, I would bet $10 on a donut that you guys are all adrenaline junkies. Is that a fair guess? You're do addicts. That's my new word, do addicts. You gotta do all the time. You gotta be doing. We give our colleagues grief if they're like sitting back, they're not doing anything. Maybe they're thinking, maybe they're planning, maybe they're doing that. They're not doing anything. And so we're always into doing checklists, all that other kind of crazy stuff. And when you're that disconnected from your center, you miss opportunities to really cultivate courage and compassion. If you listen to Maya Angelou, and who doesn't, courage is really the cornerstone of every single virtue. You need courage to be truthful. You need courage to be kind. You need courage to, I can't think right now, but you need courage for everything. And sometimes we shy away from being courageous because of a lot of crazy stories that we tell ourselves that aren't true, right? I'm just a nurse. No one listens to me. I can't really make a difference. Does this sound familiar to anybody? And we buy into that. And some people, like myself, you spend a lot of years of your life believing that crap and holding yourself back and not really letting your beautiful light shine. And that's what compassion does for us. Compassion allows our light to shine. The kindness is really the operational strategy of compassion. When you look at the definition for compassion, it's a sense of concern that arises when we are confronted with another's suffering and feel motivated to see that suffering relieved. It's different than sympathy. Sympathy, I feel bad for you, but I'm not going to do anything about it. Like, that's really tough. And then you kind of go on your way. But when you're compassionate, you are motivated to do something about it. Think about your practice, right? Think about the baby that is having a procedure and they're not getting their procedural pain managed. You know, the compassionate nurse hopefully will step in and say, hey, looks like you could use some help with that procedure, Barbara. Let me help you, right? And Barbara might say something like, oh no, I don't need any help. And you remind Barbara lovingly, I'm not here to help you, Bob. I'm here to help the baby. And saying that takes courage, right? It is if you know my Bob. It takes courage. But we can't pass those opportunities by. It's our moral agency to do that. And it's also our moral agency, though, to be compassionate to Barbara as well. Do you see where I'm going with this? But just saying it, me just coming up here and saying, okay, I want you all to be courageous and compassionate. That's the end of my talk, and I'm all done, and you guys are now going to be transformed, right? Just because you hear me say something doesn't mean anything's going to change. You have to internalize that. We really need to reflect on that. We really need to uncover the true courage that lies within us to make those changes happen. So I said kindness is the operational strategy of compassion, and compassion is really arises from our ability to empathize with other. It's our ability to connect with the lived experience of another person and say, hey, that must really suck. Let me help you some way. And then that kind of spurs us on to cultivate that compassion. We know from the literature that we can educate folks. We can train people to be compassionate. Has anybody read any of this literature? Do you know how you train people to be compassionate? You can raise your hand. Yes, ma'am. Pardon? Absolutely, yes, role modeling. You show compassion. So thank you so much for doing that. So I've been practicing my tolerance of pregnant pauses because usually I just jump right in, so this is really helpful. Does anyone have another strategy that comes up? That's a brilliant one. What other strategy pops into your head? Good job.
But for the last 5 years or so, I've been really personally working on meditation and looking at kindness, compassion, joyfulness, and also that concept of being not able to change everything. That's able to set apart.
Beautiful. She meant mindfulness, meditation. And that you're exactly right. In the literature, again, yoga practices, meditation, being compassionate to others, those are all very evidence-based strategies that really do help people learn how to become compassionate. The first step in learning how to become compassionate is being compassionate with yourself. How's that expression go? The way you do some things is the way you do everything. If you're not kind to yourself, Jean Watson talks a lot about this. Jean Watson is a nurse philosopher who I'm madly in love with. She doesn't know this, but she's amazing. But she talks a lot about how we have to care for ourselves in meaningful ways. I used to think self-care was coming home after a shift, and it didn't matter if it was day or night, pouring a glass of red wine, plunking on the couch, and turning the DVR on and watching Ellen reruns. I love Ellen. She always brings a smile to my face. And I thought that was self-care. How many of you guys would think that was self-care? Thank you. I'm like, really? I know I'm not the only one. But what I've learned in this journey is that those actions that I was doing, that was self-numbing. I was just really trying to make all that stress and distress go away and fall asleep and pretend it didn't happen. I really wasn't taking care of myself. One of the key strategies of being compassionate, you're going to pick up from this chick.
One of the most shocking findings of my work was the idea that the most compassionate people I have interviewed over the last 13 years were also the absolutely most boundaried. Because
most boundaried.
So I'll give you a great definition of the definition of boundary that I use in the book. Boundary is simply what's okay and what's not okay. What I think we do is we don't set boundaries. We let people do things that are not okay or get away with behaviors that are not okay. Then we're just resentful and hateful. Me, I'd rather be loving and generous and very straightforward with what's okay and what's not okay. And I learned from the research. I was the exact opposite. I assumed for the first 35 years of my life that people were sucking on purpose just to piss me off. That's what I assumed. That, Yeah, whether it was someone who worked for me or it was family member who was constantly like, I was always critical and judgy. And I was like, why are they choosing these things? Why are they making their choices? They should know better. And then when this thing came up from my therapist, what if people are doing the best they can? I thought my husband had the most beautiful answer to that question. He said, I'll never know whether people are doing the best they can or not. But when I assume people are, it makes my life better. So now I think I am not as sweet as I used to be, but I'm far more loving.
It's not just some like technique so that you can do that. That's really like a way of being to like nurture that soil of wholeheartedness.
Yeah. Generosity, to assume the best about people, is almost an inherently selfish act, because the life you change first is your own.
Love yourself.
Yeah. And so my question is big, B-I-G. What boundaries need to be in place for me to stay in my integrity and make the most generous assumptions about you? But generosity can't exist without boundaries. And we are not comfortable setting boundaries because we care more about what people will think, and we don't want to disappoint anyone. We want everyone to like us, and boundaries are not easy. But I think they're the key to self-love, and I think they're the key to treating others with loving kindness. Sustaining. Nothing is sustainable without boundaries. I think compassion and empathy are different things. And again, I'm relying on my data for this. I think compassion is a deeply held belief that we're inextricably connected to each other by something rooted in love, in goodness. I call that God. Not everybody calls that God. My dad would call it fishing. Fishing?
Is it fishing?
No, there's no G in fishing. Okay. But I think compassion is a deeply held belief. I think empathy is the skill set to bring compassion alive. So empathy is something we can teach. It's something we've taught our kids since they were very little. It's about how to communicate that deep love for people in a way so that people don't know they're not alone. I think there's a lot of new interesting information out there about empathy not being a good thing, about that, there's an argument that says, if Travis is in struggle and I practice empathy with you, I'm taking on your darkness, and it leads to burnout but empathy is not feeling for somebody. It's feeling with them. It's touching a place in me that knows where you've been, so I can look at you and say, me too, brother. You're not alone in this. And I find empathy to be infinite. I think it gives back tenfold what you put out.
It's sustaining.
If
you've done the work and you have your boundaries, you could tread that water forever and never get tired.
Okay, so empathy. I'm quoting Travis here. Empathy. If you've done your work and set your boundaries, you can tread that water forever. Yeah. Amen. It's not finite. And it keeps giving back to us. And so this idea but here we go back to where we started this conversation. Empathy minus boundaries is not empathy. Compassion minus boundaries is not genuine. Vulnerability without boundaries is not vulnerability. So you see that there's a huge riff here, which is boundaries are freaking important. Right. And they're not fake walls. They're not separation. Boundaries are not division. They're respect. Here's what's okay for me and here's what's not.
You gotta love that chick, right? Seriously. So what did you take away from that? Are there boundaries, right? And thinking about what she's saying, where do boundaries fit in your life that will help you be compassionate, help you be courageous, help you let your light shine? Where are those boundaries? I can give you one example I think of from my own life from work. I'd always pick up a shift, always. And I think the charge nurses knew it. Call Mary. she'll work. And I would just work. I got my Brigham folks here, they know, right? And I think some of them are also like that too. And it wasn't serving me. You get the overtime check and stuff like that, and you go, woohoo, but it wasn't serving me because I had split myself up. I wasn't this one whole being. I was basically a brain that was dragging around a body that had buried her soul in the cellar. That was the life that I was living. I know, it probably sounds really sick. And it's taken me a while to discover that in those times when I was the brain dragging the body with the soul buried, that I wasn't the best version of myself. I was wicked good technically. I felt like I was really smart. But I think I missed opportunities to be consistently compassionate. All right, I'm not going to totally throw myself under the bus. I was pretty okay. I was kind. They're nodding their heads. But I wasn't as kind to myself. That was the boundary thing. I missed on those opportunities. And when you miss those opportunities to create those boundaries, you really miss opportunities to stand in your power and shine. I'm working with this amazing group of international interdisciplinary clinicians for the trauma-informed care certification, which I know has been a long time coming. Please be patient with me. We're almost ready to launch. But in the journey of doing that, we identified 8 attributes of a trauma-informed professional. I'm going to give you the top 4. I'll tell you the other 4 if you want later. But the top 4, knowledgeable, right? And Charlotte before us and many of the other speakers, knowledge is a cornerstone of the work that we do. We have to know best practice. We have to know the latest and greatest stuff, right? That's a really important piece of it. But it's not everything. Just because you're the smartest person in the room doesn't mean you're going to do anything with that knowledge. Alphabet soup, and then you could be the least developmentally supportive person on the planet, but you're wicked smart. You got a lot of it, isn't it, after your name? So that's the first one. The other 3 are healing intention, personal wholeness, and courage. Because if you don't feel solid in your power, right? If you don't feel courageous, you can't operationalize or act on your knowledge. You might be able to, like in your little corner of the world, when you're doing up your patients, you're applying your knowledge there. But that doesn't serve the unit. It doesn't serve all the patients, right? You see where I'm going with this? Am I making sense? All right. So what I'm really trying to help you see is that, and of course I'm telling you from my perspective, right? So for a long time, being a psychoadrenaline junkie and a do addict, I buried my soul. I just thought, and it was really accepted practice, at least the way I interpreted things, that we don't need people being mushy and gushy while we're trying to save lives. All right? This is important work, and we can't have you crying and getting all soft and gooey while we're trying to save a life. Like, apparently, it's mutually exclusive to do that. But it's because we didn't set up boundaries, right? And so your primary patient that you've been caring for the past 3 months dies. You're on admits now. Right? I don't know if that happens anyplace else. I think it does. Yes, it does, right? But, right, we don't have boundaries. And the verbal and nonverbal communication we hear is push that soft and squishy stuff down. Nobody wants to see it. And so you do, right? You bury your soul in the cellar, and that it takes a toll on you. It takes a toll on how you can be present with your patients, which is so important, how you can be present with the families. And I loved the poster presentation talking about trauma-informed care for the NAS patients. What an incredibly marginalized, judged patient population who have suffered more trauma than Carter has liver pills. And we're not operationalizing our compassion and courage to really connect with them in a human way. Right? There are certainly biological aspects and attributes associated with empathy, right? People have done MRIs and done all this other kind of stuff. I'm reading my notes on the slide because I don't want to leave out a brain path that I'm going to be talking about here. But basically, empathy is supported by this network that's basically all subcortical, right? It's the limbic system, it's your autonomic nervous system, it's the striatum, the hypothalamus, the amygdala, anterior cingulate cortex, I can't even speak. It's all of these tiny little aspects that are in the subcortex of our brain that are responsible for how we feel. And I love that it's connected to the autonomic nervous system. Because what does that tell me? I have a biological variable that I can look at, and it can inform me of not just whether or not you're septic or you're in pain, but are you afraid? Are you having anxiety? Or do you feel safe and secure? Not just are you asleep, but what's that whole piece of it? But I don't pay attention to that if I'm not connected to my heart and my soul, my compassion. But in order for me to do that in an adrenaline junkie world, I have to be courageous. I have to say, you know what, I am gooey. Like it or lump it. These are my boundaries, and this is what I will do. And feel okay about that. And as I say that, I hope you all march out of here and go, yeah, I'm gonna be gooey too, and we're gonna just all be gooey together, and it's gonna be great. You have to figure out what that's gonna look like for you in a real, authentic way, but the journey that you take to get there is through what you were sharing, meditation, yoga, presence. I just heard this really cool thing by a group I'm working with over in Scotland, which is wicked awesome. A sound bath. Has anyone heard of this? A sound bath? Yeah, apparently you go to this place, you have yoga stuff on, and you lay down and they play sound music, sound stuff. I don't know, but they call it a bath. It's really amazing. And apparently you go meditative and you go like in this other zone place. It's really amazing stuff. I have to check it out. I don't know if they have it over here, but we have to really get in tune with that. And I think y'all know 2020, right, is the year of the nurse and the midwife. This is our year to shift everything. Now, are there gentlemen in the room? I love you, I love you, I love you. I love you. Our field of medicine and basically our entire planet has been really swung heavily over to masculine energy. Are you all familiar with this? Have I gone too far? All right. Bear with me, all right? There's a lot of masculine energy in healthcare, in business, on the planet, in nursing too, right? That's why we're ICU junkies, right? Because there's a lot of masculine energy there. It's thrilling, right? It's exhilarating. It's challenging, all those other cool things. But we need to shift. We don't have to go all the way over here to like feminine energy is cool, but too much of it. We need to be right here in the middle. We need to find that balance. And in that balance is the beauty of what we do as nurses. And I know it's an interdisciplinary. I'm talking to the nurses, but if you're not a nurse, help the nurses, okay? Because they need to do this. What is the primary responsibility of the nurse? To care for the human experience with disease. That's what Florence said. She wrote the rules. And that's what we need to do. But we don't focus on the experience. We're getting better. And I'm making generalizations because I know you guys in the room do. But we need to help everybody do this. Coming back to center. It's not about us being a bunch of really great brains dragging these bodies with a soul stuffed in the cellar somewhere. We need to realign and reconnect. What is it? Head, heart, and hands. And really emulate what it is, the essence of what it is that we're called to do. Being a nurse is one of the noblest things on the planet, in my opinion. And I think we have not shown our light for fear of a lot of different things, not fitting in, looking too feminine maybe, look too frilly and soft and gooey, and in a male-dominated or masculine energy. It's not, because men have feminine energy too, right? It's that masculine energy thing that divorces ourselves from our true essence. And you know what those little people are that we're taking care of in the NICU are? Along with every other baby on the planet? They are just radiating joy. I know they're wicked sick, but they are like these balls of joyful energy that they will dull without our engagement, without our connecting, without us being present and operationalizing authentic compassion consistently and reliably. Their light will dim. And we've seen this, right? I tell the story of this little baby a million years ago when I was first at the Brigham. She was sicker than stink, growth-restricted person, right? So not only a premature, but you're growth-restricted too. Ugh. And she was on the oscillator. She was so sick. And basically, we had maxed out on everything. And so we were going to redirect care. That's our euphemism for we're going to go to comfort care, whatever term you guys use. But we were redirecting care. And so it was decided, since we can't do anything else, it's okay for the parents to hold the baby now. And I forget how old the baby was, but I know she was at least a couple weeks old, at least. And so this was the first time the parents were holding the baby. And she was on the oscillator. And of course, nobody can die in kangaroo. At least that was like the way I felt about, you can't die. We're going to keep keeping you alive, okay? Because you can't die on mommy or daddy. And it was just this thing that I had in my head that we couldn't let it happen. So all of the nurses that I worked with that night all helped me and the parents, and we got the little baby on the mummy's chest. And then you put the curtains around because it's an open bay. Start documenting, doing your thing. And the alarm goes off, and I'm thinking, oh, fudge, I should have silenced it. I should have shut it off. I don't want to disrupt their time. Go into the curtained area, and this little knucklehead is hyper-sadding, right? So I'm like, okay, turn the O's down a little bit. Sorry, back out. Alarm goes off again. Now it's like the O2 and the blood pressure. blood pressure's up. I have to lower the dopamine, or she was on epi, I don't know, she was on crazy stuff, right? So make a long story short, which I'm really not good at, she didn't die. She didn't die. This kid was sicker than stink. She was supposed to die, and she didn't die. And for the next, it was like 3 days in a row, the parents were at that baby's bedside continuously in the kangaroo chairs, just went back and forth on mom and dad, mom and dad, mom and dad, and lived. And I can't, obviously, this is a long time ago. This is probably like 1990. Some of you might not have been born. It was a long time ago. And I still remember like the awe of that and really trying to figure out, because we would talk about it. Why do you think this happened? Oh, she must have dislodged a mucus plug in her airway or something like that. Yeah, that's probably it. That's probably it. I had no idea. And then you just start, over time, you start realizing like, holy smokes, that was something else, right? And I think we miss those opportunities, and I get it. We're scared. We don't want anything bad to happen to these people. But I think we have to find a balance and reconnecting and rejoining the humanity and the science, or the science and the soul, and the work that we do. And when we do that, we're operationalizing our compassion, but it takes courage to overcome the fear that something bad's going to happen to these people. Because on a regular day, I wouldn't have put anybody on an oscillator on a mommy or daddy's chest, even if they weren't dying. I just wouldn't have done that. But why? Because that's my comfort level, and that's the way we do things. So realizing that a lot of the things that we say, they're for us. They're really not in the best interest of the patient. And I know, I'm not saying, so tomorrow everybody goes on the chest. I don't care what your ECMO, anybody, they go on the chest, right? I'm not saying that. My mother-in-law says, an inch is a cinch, a yard is too hard. It's about taking those baby steps to make it happen. But we need to remind ourselves, and this is from the Dalai Lama, so this is pretty important stuff, right? Love and compassion are necessities. They're not luxuries. So that warm, gooey center, let it out to play. It needs to be seen. It needs to balance that masculine energy, that intellect, that adrenaline rush, and all of those other cool things that stimulate you and get you off on being a NICU nurse, which is wicked awesome, but it needs to be balanced. The video at the beginning gave you a lot of these benefits. So these are some of the psychological benefits of compassion, and I have to show this slide because I put it in my objectives. And these are the physiologic health benefits of compassion. So if you're grading me right now, check, all right? Check. I did it. But the other thing that I want you to know, I'm kind of all over the map with this, but that's really what compassion is. Compassion touches us everywhere. It touches us in our heart, our soul. It touches our telomeres, okay? I had to throw that in, right? Because I know my audience, right? You're like, oh my God, really? Your what? It touches your telomere. How many folks know what a telomere is? Don't read the slide. You're so wicked smart. That's really awesome. I remember when somebody was sharing with me about telomeres, I was like, I remember it like from a distant memory, like I had to dust it off, and I actually had to Google it. But so I Googled what a telomere is. I think this image is actually a better description of what's really going on. So the telomeres, those in the younger little chromosome, those are the telomeres. I liken them to the little caps that you put on the bottoms of your dining room chairs so they don't scuff up the wooden floor. That's what to me, that's how I think of a telomere. And over time, it wears down. And that's what happens to the telomeres. And so what this study looked at was the impact of compassion on telomeres, just because we like to do stuff like that. And lo and behold, the people that went through the compassion meditation training, their telomeres did not shrink, and the other people's that didn't do the training shrunk. Now, telomere length will shrink or degrade, actually, in a variety of different settings. And it's not just chronological age. Stress, adversity, chronic illness, all those other kinds of things will erode your telomeres. And why this is important is because those tips are super, super densely packed with DNA material, genetic material, and it's there. What's a good analogy for this? Like when you're running out of something or you need something to fix a pipe that's leaking. You got a leaky pipe. It's where all the tape is, okay? You grab and you just keep wrapping it around, right? You just keep wrapping it around and that sort of thing. So that's what the telomeres are. Did I just screw it up for you guys? You're like, that was so not helpful. Not a good analogy, Mary. But it's just densely packed. So the more densely packed it is, the more you can heal. So now that I'm old, like boo-boos don't heal as quick, the skin's doing some strange things and other things because I'm running out of DNA material. My telomeres are shrinking. Does that help? Is that a better analogy? You're like, move on, Mary, just pass over this slide. But it's wicked interesting. I thought it was wicked interesting that it's a crucial part, blah, blah, blah. The shortening is linked to aging of living chromosomes. But basically, if you practice meditation, if you practice yoga, the presence, healing intention, those types of things, it will actually preserve your DNA potential. Doesn't that make you want to all run to a yoga class? Me, yes, all right? And I love this quote by Teddy Roosevelt, right? You all know this one. No one cares how much you know until they know how much you care. The patients who we serve, they expect that we know our job. You're in an ICU, you freaking better know how to save a life. But that's not all I'm coming for. I want to come and feel cared for. I want you to give a hoot about me as a human being, not just like I'm wheeling into an auto body shop, which a lot of times it can turn into that, right? When we detach ourselves from our heart space, from our soul in the work that we do, we used to, or at least I used to be taught, I was taught, that keep that to yourself. You got to distance yourself. These are tragic things. Don't get connected to the patient because then you'll be useless and you won't be objective and you'll just be useless. And when you do, anybody else get that either verbally or indirectly or directly, right? Just suck it up. You have to be objective. When you do that, what happens is you end up isolating yourself. And we are a social species. We thrive in the tribe, right? We need to feel that sense of connection with others. And when we don't, it's very damaging to us, right? And it actually increases our risk for burnout, compassion fatigue, emotional dissonance, and all these other trauma exposure responses have been reported by this really amazing author, Laura Vandernoot-Lipsky, who talks about trauma stewardship, how we protect ourselves from the exposure that we have in bearing witness to these tragedies. It's just one of those things that we really need to realize that if we're not demonstrating compassion to others, if we're not being compassionate to ourselves, we are signing up for burnout and compassion fatigue. And in the literature, we know that's bad. These are some of the indicators that there might be some trouble afoot. You're seeing an increase in medical errors and patient mortality and all these other types of things. And this other group, and I apologize, it really is a wicked eye chat, isn't it? They identified some risk factors for burnout. And what they've identified are professional factors like workload, high workload, low support, lack of room for maneuvering. And I remember when we were in the basement at the Brigham, it was as tight as anything. And I don't think we really didn't like the families, but when the families came in, you literally couldn't get to the equipment. It was just a crazy setup. You guys remember that, right? So those types of things really can adversely affect the professional practice environment, right? Really adversely affects your ability to feel valued, to feel good about your work. Now that's juxtaposed to whatever the heck else you got going on at home, right? It's not like you're just like, life is falling apart on the personal front. You just zip it up. Okay, I'll be back at 5, and I'm great now, and I can go to work. And then also throw into the mix whatever your backstory is. So I forget the name of the woman who talked about the trauma of the NAS patients, but we know just in general across the human population that early childhood adversity is pervasive. I think it was something like 2/3 of the population have had at least one adverse childhood experience. And so that's also your backstory, you know? So all of this stuff comes to play, and then you come to work and you're gonna get treated like crap there as well. Gee whiz, right? You can really see how all of this stuff is going to really degrade your ability to really fully be present for your patients, be compassionate in an authentic way, because you can't even care for yourself. I hope I'm not bumming you all out, am I? Like, no, we're okay. Just a few more ones to punch you right in the solar plexus, because what we know is loneliness kills. We know that isolation kills. This was a really interesting paper looking at the risk of heart attack, and that it was more prevalent in people that were unmarried and didn't have really good social network. So I want you to think about that in relation to the patients who are very isolated, and sometimes we isolate them. It's not a touch time. I'm sorry, Mom and Dad. Come back in 3 hours. That's isolation. The families, how isolated they feel. I've not had the experience of a premature baby. I have spoken to parents though, and you're off the chart now. You're off the rails for normal anything. This whole new experience has put you in a new place, and you can feel very isolated. And then us as well. How many of you guys say stuff like, we tried to get this new equipment, but nobody cares about us. We're the redheaded stepchildren in our hospital, and wah, 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 right? If you want to believe that, go ahead, keep believing that, keep saying that. Or you can change it. But it takes courage to do that. It takes compassion. Remember what compassion is? It's a motivation to ease somebody else's suffering. It's a motivation to change a situation that needs to be changed. Yeah, and many of you, I'm sure, have seen this, but we know, talking about isolation and neglect, right, which neglect is basically not meeting someone's human needs, their developmental needs, that people that have neglect have smaller brains. And this little brain here was a survivor from the Romanian orphanage, but our premature people also have the same brain constricted growth. Human connection matters. It matters in a really big, huge way with each other and with ourselves. And so I'm going to get a little quantum-y on you, okay? And it was just like a recent aha moment that I had when I was thinking about just like how we are as human beings. I don't know how this is going to go over, but just, you're here. I was thinking of myself and the connection that we have to each other, like the solar system, all right? So think about the solar system, think about the universe, right? There's stars and moons and planets and other stuff there. And we're part of that. We're part of that big universe, right? We're connected. It's one whole thing. And then I was like, oh my God, like my whole body inside, if the incredible journey, right? When they were driving around inside the body, same thing, right? I'm made up of all of these different parts and cells and atoms and electrons and all this, right? It's just this, we're all connected. I am connected to you. I am. Subatomically, we're connected. We're all connected. And when we don't pay attention to it, we miss opportunities to really reactivate the light that's in us, right? That beautiful healing energy that we have inside of us that we're supposed to be sharing with everybody to do the good work that we're called to do. With our intellect and our adrenaline and all the technical cool equipment that we get to play with and stuff, this piece is vital for us to get it right. Touch a life, impact a lifetime. That's what we do every single day. Not a lot of people get to do cool stuff like that. That's the cool stuff we get to do. So we need to remind ourselves of that.
I would define compassion in a nutshell as a natural sense of concern that arises in us in the face of someone who is in need or someone who is in pain, and accompanied by a kind of a wishing to see the relief or end of that situation and wanted to do something about it. So compassion is not just an emotional reaction. There is also a more motivational kind of element which makes us want to do something about the situation. One of the interesting things about our contemporary modern society is that given the highly competitive nature of society and also the way in which we bring up our children and the way in which we ourselves grew up, which involved huge amount of evaluation and judgment and comparison across with others from a very early age, we have internalized a certain kind of way of being in the world and perceiving our relationship with others. And that dynamic has created a certain kind of inhibitions against our natural compassionate instinct. And these inhibitions really take primarily in the form of fear. For example, many people worry and are afraid that if they are too kind and too compassionate, that other people will take advantage of them. They will see them as pushover or weak or losers. So that's one type of fear that we bring. Another type of fear that we bring is that because in popular understanding of compassion, it's so dominated by compassion as an emotion, kind of a soft heart and tender heart and so on. So people worry that if they allow their compassionate and kinder instinct to become more dominant in their way of interacting with the world and others, somehow it might undermine their more rational, tougher side, so that they may not be able to succeed in their life and compete. That's another type of fear. And then sometimes in intimate relations, particularly between parents and children, on the part of the parents, sometimes we also worry that if we are too kind to our children, we might be spoiling them. They might become over-dependent upon us, and then somehow we will end up having to do everything for them. So these are various types of fear that we bring into our expression of natural compassionate instinct. And a lot of these are subconscious biases that we bring. People may not necessarily sit down and think, that's what I'm going to do. But these are culturally acquired sensibilities and biases, which also makes us suspicious when someone is being kind to us, compassionate towards us. We start wondering, there must be a hidden agenda. That person must want something from me. So it's very unfortunate. These are various forms of culturally acquired fear that really undermines the expression of what is really natural to our human being, which is the ability to connect with someone, the ability to relate to that person at a deeper level and have a much more open-hearted kind of interaction.
Check out his book if you find this topic fascinating. It's called A Fearless Heart, and I think it's The Courage to be Compassionate or something. He's a Buddhist guy, maybe monk, but he was like this with the Dalai Lama. And he writes about it in the book and stuff like this. So just really cool, like deep stuff. So how do you cultivate compassion? You start with yourself. Be present in every situation. And that's a journey in and of itself, to really stop and smell the roses, that expression, to really stop. You don't have to stop for 20 minutes. It's like a second, and just be aware of how you're feeling in that moment. And the more you practice it, just like anything, right? It gradually becomes second nature. Learn to listen. Get over pregnant pauses. Usually it'd be like, in my head, I go 1, 2, 3. Oh, because I can't stand the tension. Can't stand it. You guys were great. I really helped. I needed the practice. But I know I'm not the only one. Giving yourself that space and giving others the space. It takes courage to speak up in a group like this. I need to give you more than 3 seconds to operationalize your courage. Practice self-control. Embrace forgiveness. Try compassion meditation. Be someone people can look up to. Part of this journey that we're all on, right? We're leaving a legacy. What's your legacy? What are people going to say about you at your funeral? Not to get morbid or anything, but right? That's your legacy, right? That's what they'll remember forever, okay? That's why I was trying to say that. I wasn't trying to get morbid. Oh, my God. Mindfulness meditation is a way of looking deeply into oneself in a spirit of self-inquiry and self-understanding. It's not about judging yourself. If you start hearing yourself say shoulda, pay attention and let that one go. Because the only person that thinks you should have done anything is you. And you're the worst person you know to yourself. The way we talk to ourselves, in general, we wouldn't talk to anybody else that way. You ever miss an IV or something and go, you stupid idiot. God, you suck at this, right? Would you say that to your friend? God, you suck. I don't know, do you have a license? You wouldn't do that. But we do this to ourselves, usually. On your little piece of paper, I'm watching the clock. I want my little timekeeper to know I'm on it. I want you to just jot down, what does compassion look like in your clinical practice? I'll give you 15 seconds to write that down. What does compassion look like in your clinical practice? As in the wise words of Brené Brown, we can't practice compassion with other people if we can't treat ourselves kindly. And this is this model. Kristen Neff does a lot of research, and she's got several books talking about self-compassion and self-forgiveness and that sort of thing. Really cool stuff. And she talks about self-kindness versus self-judgment, mindfulness over identification. In the US, we're great at this. Somebody will come up and ask us something, and we define who we are by our job. What do? I'm a nurse. Okay. Like, all right, there you go. And that's it. That's everything. Instead of, I'm a mom, I'm a grandma, I like to crochet, I'm trying to work on the ukulele skills. I dabble. I'm a dabbler. We just go, this is what I do. And if I do that good, then I'm all set. But thinking bigger, I got myself into this big pickle of travel nightmare HE double toothpicks over these past few days because I made a decision, and I've decided I'm not going to regret this decision, regardless of what has happened over the past 48 hours. I want to be that grandma that's there for the big events. So my son and his little family, they live in Las Vegas, and I live in Boston. And Emma, my oldest grandbaby, just turned 16. I said, I want to be there. I want to be there. And my husband, everyone's, really? Aren't you flying to Florida? And I'm like, I am, but I got to be there. You could Zoom, you could FaceTime. I know, but I want to be there. So it's like the boundaries thing. And now I had to take my lumps, but it's okay because it was so worth it. It was so worth it, right? So give yourself that permission for me, that was self-care. That let me be grandma for actually 2 days instead of 1 day, which was pretty cool. I've got this video that I'm going to jump over, but if you're interested in it, it's from Kristen Neff, N-E-F-F, and it's about self-compassion. So if you want it, I will send you the link. Are you okay with that? All right, because I don't want to go over my time. So I'm jumping. It's a funny thing about life. Once you begin to take notice of the things you are grateful for, you begin to lose sight of the things that you lack. Really embracing an attitude of gratitude really helps you cultivate that courage to identify the need for self-compassion. And then once you get your own self-compassion down, it's so much easier to operationalize it for others. So I'm going to have you do this little quick gratitude exercise. You ready? So I want you to take out your pen and paper. And I want everybody in the room, write down 5 big things that you're grateful for. You've got 15 seconds, 5 biggies that you're grateful for. Oh, thank you. You got it, everybody? So now part 2 of this exercise, now I want you to write down 5 small things that you're grateful for from just today. 5 small things that you're grateful for just today. Y'all good? So how was it? How hard was it to write down the 5 big things? Raise your hand if it was hard. Okay, good. Was it hard to write the small things? Some people are saying yes, some people are saying no. Raise your hand if it was a little bit harder. It doesn't have to oh my God, but was it a little bit harder to write the small things than it was the big things? Yeah, that usually happens. Why do you think that is? Right, yeah. We're not used to smelling the roses. We take a lot of those little things for granted. We don't think they're worthy of celebrating. I had the best cup of tea this morning. It was the absolute best. I don't know what it is about tea when somebody else makes it for me, and it's the same bag, same water, but when somebody else makes it for me, it tastes so much better. Anyone have that experience? And you're supposed to appreciate it. How many of you guys do a gratitude journal? All right, I'm making it an assignment for all of you. Get a gratitude journal. They're like $5. You don't even need to get it. Just get a piece of paper. And every morning, wake up and just write down 5 things that you're grateful for. I woke up. Start with that. And then at the end of the day, write down 5 other things that I'm grateful for. You will be blown away. We could do a trial right now. I'll see you next year. Bring your gratitude journals, and then we'll talk about it, okay? Because you'll be blown away by what a difference it makes for your attitude. And then once you get your vibration up higher, it's a lot easier for you to realize, I could be present for these things. Because when you are grateful for those little things, you get connected. And the more you can connect with that sense of appreciation, you're taking care of yourself. And you start nurturing that. Compassion begins with you. It begins with you caring for yourselves in meaningful ways. Right? How often? The brain's, look, we did all this good stuff. No, the heart, rather. Sorry, I had it backwards. The heart, look, and the brain is, wait a minute. No, I screwed up. I know I gave a shitty report or blah, 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 blah. We beat ourselves up. And even though we might have done all of these amazing things, we are the worst people to ourselves, and we need to cut it out. So I've got 2 minutes left, and I want to just read this little thing for you guys. And you could jot some stuff down, okay? If you could, that would be really awesome. If I asked you guys, right, to everyone just be still for a second, okay? Just be present in your body. Just take some breaths and just be aware of it, be embodied, okay? Come out of your head and drop down into your body. And ask your soul or your spirit or your heart, whatever it is, what do you need to be nourished? You don't have to answer it. I want you to ask it of yourself right now. Breathe in and out. Close your eyes if you need to. And what is your soul telling you? What is your soul telling you it needs for you to be nourished? I'm not looking at you. And write it down. And if I don't know how many of you guys are familiar with the 5-second rule. The 5-second rule is something bubbles up, right? Your inner wisdom or your spirit or whatever, your soul, whatever, your intuition, you call it whatever the heck you want, will generally give you a really great idea. If you don't act on it within 5 seconds, you probably won't ever do it. So if there was something that leapt up in your heart and said, go buy some bubbles and have a bubble bath tonight. If that bubbled up in you, go do it. Go to Staples or wherever the heck they sell bubbles and get some right now. Do it. But what I'm trying to say is be present in your body. Reconnect. Don't be the brain dragging the body with the soul stuffed in the cellar. Don't do it to yourselves. It's not worth it. Bring yourself back into alignment. Become embodied and figure out, how do I nourish that light that is dying to get out of me? And I swear to God, in a stack of Holy Bibles, you guys, if you can do this, it will change everything for you. And that's what it's all about. We all care about the patients, right? But the quality of the experience that the patient is going to get it rests on you. It rests on how wonderful and awesome and beautiful and shiny you're feeling, and how you're nurturing that. How you're able to be compassionate for yourself is how you can be compassionate for others. I see the red thing there. So I'm not going to ask you to answer this question, but I do have to show off those. So this is one of my newer grandbabies, right? Delilah Rose, gorgeous little muffin there. And then a little pearl of wisdom. What we now know for sure is that the intangible dimensions of the human experience leave an indelible imprint on our psyche, our physiology, and our lifelong health and wellness. That's for you, the families that we serve, the patients, your colleagues, your family, everything. So be nice to yourselves, all right? You absolutely deserve it. You're beautiful people. I love you, and I want you to all love yourselves. I'm going to make myself cry. Thank you so very much, you guys.
So what did you think? Wasn't that an amazing presentation by Mary? I love that at the end she invites us to really reflect on our own practice. She encourages you to start a gratitude journal, to not miss out on those little things in life that we might be busy and deep in the weeds on something else and miss the little things. Just thinking about that and just implementing that in your own practice can help you to be more compassionate to yourself, which will in return end up helping you to be more compassionate to your coworkers, to the families and the babies that we care for. And that compassionate care is really at the heart of everything we want to do in the NICU. So I hope you've enjoyed this entire series on caring for and from the heart. We've covered everything from complementary care to using AEEG with congenital heart disease, improving developmental care in the CVICU, and now rounding this out with compassionate care in the NICU. I really hope that you have enjoyed them all. If you've missed any of these presentations from this month, go ahead and look in our show notes or go to our homepage on our YouTube channel and go back and look for the presentations from this series. I hope that you enjoy this as well as any of the other series we have on our channel. If you haven't already, what are you waiting for? Go ahead and click that like and subscribe button. It helps us out a lot. And if you want, hit that notification bell on YouTube so that you get notified when new videos go live. I hope you have a great day, and I will see you next time. Bye.